Cameron and Jannese here from Magnetic Experience. Today we're going to talk about magnetic therapy and shoulder pain. Just a quick oversight on magnetic therapy is that by placing a magnet on a certain area, it increases blood flow, which in turn will reduce inflammation and pain. So we've devised a number of products, area specific to assist pain relief in certain areas of the body. So today we're talking about shoulder pain, so we'll just talk about the products that we have applicable for shoulder problems. Now, shoulder can be two things. You can have direct shoulder pain, or you can have referred pain, which comes from your neck. And what you'll find is, if you've got a damaged area here, it will give you inflammation on the top area, which pulls up and gives you shoulder pain. Conversely, if it gets worse, it will go down your arm, down your hands, which will give you tingling or lack of feelings. So Jannese makes all these products, so we'll let her talk about the different products which are available for shoulder pain. Do you want to start about that one first?
Just getting back to everybody is an individual, and everybody likes their own thing as far as an area goes. So, I mean, I get people that ring up and they don't want to know about anything else but the shoulder pads. They've used the shoulder pads, they want an extra set, and the shoulder pads work wonderfully for them. With the shoulder pads, we've got 9 3000 Gauss Neo magnets encased in the shoulder pad. So they're very strong magnets, and that's why we get such good results with the shoulder pads. And it just slips into anything that you're wearing, so it can go in under the bra strap here.
Mainly for women.
Like that. Put it under the bra strap. Put it on my top just to show you. So it would go under the bra strap like that. And then, I can't see it, you'll have to help me.
You've done it wrong.
Oh, have I? Sorry.
I've
put it the wrong way.
Oh.
There you go, can't see. And then the little piece goes on top, like that, and holds it in place, and then you just get dressed over the top. You also can slide that into a singlet at night as well.
Yep.
So that's how it just holds it in place. I have actually used these just inside a pyjama top with no singlet at all. They stay pretty much in place as well. So depending if it's a stretchy sort of pyjama top, if it's stretchy, it'll stay there as well. So very, very good for sleeping in and wearing throughout the day as well.
And Jannese, talking from experience here, she was sitting at traffic lights many years ago, and someone crashed into her from behind. She was holding the steering wheel and popped the shoulder joint. You had part of your rotor cuff taken out, didn't you?
The AC joint removed, part of the AC joint removed, and had terrible problems with this shoulder. And what I find is I did use the shoulder pads, but my number one love for the shoulder area for me, and as I say, everyone's an individual and everyone likes their own thing, is the body studs. And I like the body studs. If it ever plays up, I just put the body studs straight on it, and I can guarantee within about 15 minutes I've got the pain relief. And I might leave them on, but even though I've got pain relief, within a couple of hours it's totally gone. I will still leave them on for say 3 or 4 days, just so it really gets into all the surrounding areas and
exactly
works all the way through. So even though you get results in a couple of hours, leave them on for say 3 or 4 days to really work the area.
The truth about the body studs is that they don't run out.
And once you've got them on, you can shower in them, everything, you just leave them there. And probably the most important thing is to use enough for my shoulder area. I'll start where the pain is and work all the way down towards the rhomboids with them, creating like a grid pattern of magnets over that area. I'll use 8 to 12, the whole pack on that area, and just leave them, as I said to you, and within 15 minutes I have pain relief. So that's why I love the body studs, because they're very versatile. I can use them there. I can use them anywhere on the body, but I find I do get very, very good relief with the body studs. We do use the same magnets in the shoulder pads. They are the 3000 Gauss Neo, so they are exactly the same magnets, just a different vehicle for holding the magnets in.
And the good thing about the body studs, I go speak at groups, and they say, well, you're a salesman, you can tell me anything. So what I do, I stick these on the people before I start to talk. And within 30-40 minutes of us talking, I can watch them and they go, I can feel the difference. So it's a good proof in the pudding.
And even though I've got obviously I have a problem there, I'll always have that problem there because there is damage to that area. So what I do is just every night, can I just have the pillow?
Oh.
Every night, just to keep that problem area, the circulation really pumped in that area, is I'll actually sleep on the magnetic pillow, because the magnetic pillow is very...
Well, it's passive therapy.
It's passive therapy. It's easy. You can lay on it. You don't even feel like you're laying on anything. It squashes down to virtually nothing, so you can't feel it, but you can't feel the magnets either. So just to keep that area really, I'm working it all the time, every night when I go to bed. I just put the magnetic pillow. I don't actually put it under my head. I actually just have it from the shoulders down like that underneath me when I sleep. So I really do think that does keep the problems at bay.
Oh, absolutely. And the main thing to remember is when you go to bed overnight, your circulation slows down, your lymphatic system slows down. So I've had thousands of customers ring up and say, oh, my shoulder is worse of a night-time when I go to bed. They get the magnetic pillow and the magnetic underlay, and suddenly the nighttime nasties go away. So, it's a wonderful little product, and it's passive therapy. This is area specific. You put it on that product of a daytime. The pillow and the underlay is passive. It's reducing the inflammation and pain while you sleep, and the residual effect from sleeping on the night time works into daytime.
I don't know if they can see the magnets there, but I've just pulled it down to
24.
Be able to see the magnets through the...
So 1200 Gauss magnets now. We pride ourselves, we did a bit of homework, and by using a larger magnet, thicker in diameter, we now have this stronger and more magnets than most other companies, or if all other companies here on the Australian market. I haven't found one as yet. And if there is, we'll just put more in. That's the joys of being the manufacturer. We can do everything that we want.
Same magnets as we use in the underlay.
Same underlay magnets, okay? So if you've got a shoulder problem, I've given you some suggestions, or please feel free to ring Jannese and I. We are the owners. We have lots more things we can share with you. So give us a call. And
if you've got a particular problem that you want to discuss, and you want to come up with the best product for your particular problem, just give us a call so we can give you some advice as to that particular problem that you're dealing with.
For sure. Thank you.
Thank you.